At Balikian Plastic Surgery, we're all about education. We have beautiful diagrams here of the deep structures of the face, of the SMAS layer of the face, to help you better understand what's happening under the skin when I do a facelift. So I prefer a extended deep plane facelift. I think it's a superb result. And we take great pride in the fact that our Artiste lift is really the most extensive deep plane facelift you can get. That doesn't mean a more dramatic result. That means a more consistent, more beautiful, more natural result that lasts longer, so you don't have to keep getting facelift after facelift after facelift. So as I teach you about the anatomy of the face, I want you to think of the facelift in 3 different layers that we're treating. One is the skin, right? The second layer is the supportive layer of muscle that we're manipulating. That's the SMAS and the platysma together. It creates one sheet together. This is the SMAS in yellow. This is the platysma in pink. That's what we see right underneath the skin. The third layer of the face is the deeper structures. When we lift up the SMAS muscle and we look underneath that sheet and we're looking at the mattress, this is what we're seeing. And I can manipulate those a little bit here and there very conservatively to contour the face like an artist to get a nice part-shaped face at the end of surgery. So this is a depiction of what's right underneath the skin. But how do we get to see this stuff? We do it by making incisions. So our facelift, we make incisions around the ears. We start with an incision along the hairline here, from there to there. It goes up the inside edge of the ear cartilage there, along the earlobe here, to the back of the ear where no one will see it, and slightly down the hairline. Through those incisions, we can then lift up the skin to see what's underneath. Now, most surgeons, when they make those incisions, lift up the skin all the way to what you're seeing here, all the way this cheek, down into the neck, all the way through here, into the center of the neck. And they do it on both sides until the 2 hands can connect. But that causes a lot of trauma, a lot of bruising, a lot of swelling, and the need for drains, the need for compression dressings afterwards. But we've eliminated that. We do something called a preservation facelift, where after making those incisions, we only have to lift the skin up to here. The rest of the surgery is all done under the muscle. Here's a depiction of what we do with our Artiste lift, which is a deep plane preservation facelift. So this is the top layer of skin. With a preservation facelift, we only lift the skin a little bit, not all the way here like most facelifts do. That causes less trauma when we only lift it to here. As soon as we lift there, we see the beginning of the edge of the SMAS muscle. And immediately we can get underneath that SMAS muscle and release it. The SMAS muscle starts at the temples and it runs like drapes from our temples, down over our cheekbone, down to our jawbone, and it continues on in our neck as the platysma muscle, here in pink. And in the center of our neck, it connects together, creating one U-shaped hammock of muscle that's holding our face and skin up. But as we age, gravity takes over and that hammock starts sliding down and it takes the loose skin with it, creating the jowls. And in the center of our neck, it splits right down the center and the muscle starts to separate apart and side. And you see the inside edge of this muscle show up as a band in your neck. So there are 2 types of facelifts. There's a SMAS facelift and a deep plane facelift, and they both are working on fixing this hand. A SMAS facelift says, all right, let's make an incision under the chin here. We'll tie the hammock of muscle back together in the center, called the platysmoplasty. We'll make U-shaped incisions around the ears. We'll lift up the skin until we can see that hammock of muscle underneath. Then we're going to go underneath the hammock of muscle, lift it up, and stitch it into place. Cut out the excess skin when we do that. But the problem with that sub-SMAS facelift is it doesn't take into account the fact that that hammock of muscle is also tethered down with Velcro-like attachments, as you can see here, along the cheek, along the masseter there, along the jawbone here, and in the neck. So as you do research on deep plane facelift, you'll hear about releasing the face and ligaments, and what are they, right? And they're not quite ligaments, right? When we talk about orthopedics, we talk about ligaments holding things together. They're very strong, but these are kind of like condensations of thick tissue that are holding the skin down to the SMAS and from the SMAS to the deeper structures of the face. These X's along here are attachments along the zygomaticus major muscle. Very important muscle. If you don't release those, it'll look good initially when you pull, but that muscle is going to pull you all the way right back down. So those are the ones we have to release off the zygomaticus major muscle. These 3 here are on the anterior surface of something called the masseter muscle. There are strong attachments there too. So unless you release those, everything's going to fall back down to the jowl. So we've released that, These are the prejowl ligaments, okay? They're areas that are holding the jaw in the prejowl area down. If you don't release those, you're never going to get full movement of that jowl back up to define that jaw. These ones here, a lot of people think are about releasing off the sternocleidomastoid muscle, which is here. But really, these are ligaments that are attached to the parotid gland underneath. And again, strong structure. If you don't release that, no matter how you lift with a sub-SMAS, that gland is going to pull it right back down. There are some deep plane facelift surgeons even that don't release the parotid gland or don't release the zygomaticus fully. So even though the surgeons are lifting up the muscle from here to here, when they go to lift, there's going to be a tug of war holding that down. So what do you do in a tug of war? Oftentimes surgeons will cramp really tight to get it to move. But if you're cranking against these Velcro-like attachments, all that's going to do is create bunny pulls, bunny pleats, sweeps, tension through the face, and thick scars. We don't like any of that stuff. That's why you do a deep plane facelift. So what are the variations we do? We do a full extensive release. We're releasing the SMAS muscle and the platysma muscle into the neck, into the face, all the way to the folds here and to the center of the neck. And now we're further along the face. We've won the tug of war. So now we can lift the face up without having to crank on it, without pulling as hard as we can, but just by lifting the face into the proper position like you would do in the mirror. When we do that, we've released all the attachments. When we lift, there's no tension, no funny pulls, incision lines that have no tension on them, so they're going to heal paper thin. Things are going to slide back into position and hold there for the long term. So what do I see in the deepest layer of the face? First thing, once we lift up the SMAS, is we're going to see this parotid gland. This is one of the glands that makes saliva in our mouth. And it's very important, and we don't change that. We don't trim any of the parotid gland, so you always have good salivary function afterwards. As we move forward, we start seeing this masseter muscle here. This is a muscle that helps us chew. It wraps underneath our jawbone, and when we chew, it pulls our jawbone up. Really cool one. This is where important nerves lie. That's why we know to stay on top of that muscle and protect those nerves from getting injured. As we move forward, we start seeing buccal fat here. This is deeper fat that sits there and starts to bulge for some people. Some people don't have enough. Some people have too much. So we adjust it for every patient, every surgery. Do we need to add a little fat there? Do we need to trim a little bit? We never remove all of it, but sometimes we need to take that out so you don't have that chipmunk cheek when we're done. Then, as we move forward, we start seeing the beginning of the zygomaticus major muscle right on our zygomatic bone. And this is a very important muscle. This allows us to dissect the SMAS muscle all the way down to the corner of the mouth safely, making sure you're protected from everything. This muscle is like a suspension bridge. When we're young, it's tight. It's got fat underneath. And it's pushing that suspension bridge up. That's why you have such a bright, happy smile. But as we age, that suspension bridge of a muscle starts to sag. You lose fat underneath it, and it's not working quite as well because it doesn't have the support. That's why we do fat transfer. We take a little bit of that extra fat and put it underneath that suspension bridge, and it lifts that muscle up, gives it a little more vigor, and you have a brighter, happier smile. That's what a good facelift is. A facelift isn't, oh my gosh, how much younger have we made you? It's like, how do you look brighter and happier and refreshed and rested and still look like yourself to all your friends? This here, above the zygomatic bone, is the temporalis muscle. Believe it or not, this muscle here also helps contribute to chew. So this is a very important muscle for us, and we put quite a bit of stitches to help hold everything up against that muscle. This circular muscle around our eye is called the orbicularis oculi muscle. It's a circular muscle. It acts like a perspirate. It helps us blink. It helps us forcibly blink. And that's what we're treating when we're treating Botox, is the outside edge of that muscle. So that's a good little tour of everything we see when we're doing our deep plane facelift. When we're doing our deep vertical neck lift, we're seeing the hyoid bone underneath here, the submandibular gland, and then there's another muscle there called the anterior digastric that also we see, and we can trim and contour to get a beautiful sharp neckline. So one of the things surgeons don't tell you about or talk about a lot is the fact that this platysma muscle that we're working on is striate. You can look at it. It kind of looks like flank steak, right? So people sometimes expect all the little bands to go away just by doing a neck lift. And you're right, when you tie the hammock muscle back together and lift it, it'll tighten things and pretty much smooth out those bands. But the natural anatomy of the platysma is striated like flat steak. So it's not unheard of to see a little slight variation of those bands underneath when you're done. That's why we're very conservative and rarely take fat from right under the skin. Because if you go aggressive with liposuction in your neck, you're taking away the nice protective layer of fat that's protecting us from seeing these striations. If you do it too much, you're going to see more of these bands. So talk to your surgeon. We don't want to overdo lipo. I barely do any of it at all if I can avoid it. That way we keep the protective layer and hide any of these striations. So it's important to not just fall for a name, right? There's judgment, there's extent of what we do in our deep plane facelift, and we take great pride in the fact that our Artiste lift is really the most extensive deep plane facelift you can get. Something you will wear proudly and know you look rejuvenated.